My name is Sandy Demmer. I am the cardiac rehab nurse at Southwest Health Center in Platteville, Wisconsin.
My name is Vickie Bennett. I started in 1991 at the nursing home as a CNA. I came to Platteville 5 years ago, and I'm the rehab aide.
Typically we have patients all ages, female, males. You know, heart disease unfortunately strikes everyone. The risk factors for heart disease, and as I said before, they affect both men and women, and it doesn't matter what age you are. Sedentary lifestyle being a big risk factor for heart disease. As we get older, obviously we're not doing as much physical activity. High blood pressure is a risk factor for heart disease, and unfortunately as we get older, high blood pressure seems to affect a lot of clients. High cholesterol problems, obviously a risk factor for heart disease. Diabetes is a big risk factor for heart disease. Overweight obviously is a risk factor for heart disease. Family history. If someone has a family history of premature heart disease, that is a risk factor. And as I said, age as we get older, that's definitely a risk factor as well. Smoking, a big risk factor for heart disease. Unfortunately, it's a hard habit to stop for some clients, but usually it's a big wake-up call for patients that they do really want to try to stop smoking. Stress as well is a big risk factor for heart disease. We do have a little statistic about stress. Patients that do experience anxiety, depression, or stress-related issues, and they are not being treated for those issues, unfortunately have a 17% worse prognosis if they are a cardiac patient. So we do encourage them to seek some help, whether it be through counseling or going back to their primary care physician for some medication. An appointment to sit down and visit. We talk about educational points. We talk about risk factors for heart disease. We talk more about the program as to what the actual day-to-day program is as far as the exercise. We have them visit with a dietitian throughout the program, and we also have them visit with the stress manager throughout the program. Phase 2 is kind of the transition between the acute phase of a heart event and what happens to get these patients back to doing their regular activity at home. A typical day when the clients come here to exercise, we exercise every Monday, Wednesday, and Friday. It's usually in the mornings. It takes about an hour when you're here exercising. So when you first come in the door, I have everyone weigh themselves every Monday, Wednesday, and Friday, and they have a little sheet of paper they'll record that on, and then we typically put them on a monitor. Every session that they come here to exercise is a monitored exercise session during phase 2. Alright, start them out slowly, 20 minutes. We advance clients up to 45 minutes of actual exercise, plus you need to do a warm-up and a cool-down period. Okay, our cool down usually consists of just walking out in the hallway. Our warm up are actual exercises that we have the clients do.
When the cardiac people come in for phase 3, what they usually do is they come and they rest. Then there's a blood pressure taken for the first time. They will warm up at the board. Then they will go to whichever they want to do, whether it be the bike, the treadmill, the new step. Halfway through, another blood pressure is taken, and then the last, when they're done, they'll take their cool down walk, they'll come back in, and their last blood pressure will be taken, and that's when they are offered some juice. They can do this for 45 minutes to an hour is what the sessions are. They are unmonitored. The only thing that I do is I take a blood pressure before they start, halfway in between, when they're, and then at the end. And then they're offered juice. They cool down. Some of these people have been here since the day it began.
Okay. If ever a client has a problem while they're exercising, we of course address that. It might mean stopping the exercise. It might mean taking a nitroglycerin. It might even mean taking the client to the emergency room. We make several calls to their cardiologists, send them information via the fax, or sometimes we have to actually call them immediately and send the patient over to the cardiologist. Throughout the program, we usually have the clients visit either their cardiologist or their primary care physician. We send a letter with them that we like them to read and send back to us, along with an exercise session where they can view the patient's blood pressure, heart rate during exercise, rest, and recovery. At the discharge of the client, We usually encourage the patients to make some progress throughout the program. That is an insurance. At the discharge, we do send a letter to I usually send it to both their primary care physician and their cardiologist, along with the last exercise session, which gives them the results of their blood pressure and heart rate and their rhythm during exercise and at rest and recovery.
My favorite part of cardiac are the people. You become very close to them. They are just a fun group right now. You know the families, you know the kids, you know what the grandkids, you know what the great-grandkids are doing. It's just a very social time.